I'm here to talk to you about anthrax. So just to give you some background, anthrax is a zoonotic disease caused by Bacillus anthracis. Bacillus anthracis is a gram-positive and rod-shaped bacteria, as you see in this picture right here. Its life cycle is comprised of its vegetative form and dormant spores. In its vegetative form, it produces virulent factors, which I will elaborate on in later slides. And its sporulation is a defense mechanism when the environment cannot sustain the pathogen's growth, usually when anthrax is released into soils after the host's death, as anthrax thrives naturally in soil. Its virulent factors include its antiphagocytic polyglutamic acid capsule, which defends anthrax against phagocytosis in the complement system in the host body, and it also includes anthrax toxins. Regarding its portals of entry, the type of anthrax a person develops depends on how anthrax spores enter the body. So there are 3 clinical types of anthrax. The first is cutaneous anthrax, in which spores enter through broken skin, so that would be through cuts or open sores. We also have inhalation anthrax, in which anthrax spores are breathed in and they enter through the respiratory tract. And the last one is gastrointestinal anthrax, in which infected meat from infected animals is eaten. And once it is inside the host body, the incubation period of anthrax spores take 1 to 6 days to be activated. Some spores can remain inside the body in its dormant phase and take up to even 60 days or more before they are activated. After they enter the host body and are activated, they are phagocytosed by macrophages, and actually they germinate inside the macrophages, and its activated spores then release toxins and multiply in the lymph nodes and intracellular space. The anthrax toxins, which are composed of protective antigen, lethal factor, and edema factor, alter cell signaling pathways in the host to interfere with the host's innate immune responses. Specifically, the toxins hijack the endocytic pathway of CMH2 and TEM8, which are 2 anthrax toxins receptors, which then would interfere with the host's ability to recognize anthrax as in its innate immune system. In addition, toxins cause tissue destruction and edema, which will lead us to the signs and symptoms that I'm about to talk about. So the symptoms of anthrax depend on the type of infection and can take 1 day to maybe even more than 2 months to appear. So in cutaneous anthrax, its signs and symptoms include small blisters and or bumps that may itch, swelling around the sore, and ulcer with a black center that appears after blisters and bumps. In gastrointestinal anthrax, some signs and symptoms include fevers and chills, swelling of the neck and neck glands, painful swallowing, sore throat, hoarseness, nausea and vomiting, diarrhea, headache, flushing and red eye, stomach pain, fainting, and swelling of the abdomen. So here's a picture of a patient with gastrointestinal anthrax, and I believe this is an image of that patient after reconstruction of the gastrointestinal tract. So it kind of shows the tissue damage of the gastrointestinal tract resulting from anthrax. In inhalation anthrax, the signs and symptoms include fevers and chills, chest discomfort, shortness of breath, confusion or dizziness, cough, sweats, extreme tiredness, body aches, nausea, stomach pain, and rapid deterioration. In inhalation anthrax, if the spores are inhaled, they migrate to the lymph glands in the chest where they proliferate, and then they may spread toxins from the liver, spleen, and kidneys to the bloodstream, which leads to septicemic anthrax. This causes rapid deterioration often causes death. So this is a picture of the differences between a patient with normal lungs and then someone with inhalation anthrax, and you can see the tissue destruction of the lungs. Regarding diagnosis, doctors rarely see a patient with anthrax. The only way to confirm anthrax diagnosis are to measure antibodies or toxins in blood. You can also do gram staining and other tests, or test directly for Bacillus anthracis in a sample of blood, skin lesion swab, spinal fluid, or respiratory secretions. In the case of inhalation anthrax, a chest x-ray or CT scan would be recommended. Regarding prevention and treatment, there is a vaccine for anthrax called anthrax vaccine adsorbed, and it's used for both routine occupational use and post-event emergency use. So for routine occupational use, this would be before possible exposure. It's for people who are likely to be exposed to anthrax. So this would be laboratory workers who work with anthrax, people who handle animals or animal products, and some members of the U.S. military. And they would receive 5 shots of anthrax vaccine over 18 months and a yearly booster. Along with the vaccine, people at risk take other preventative measures, including respirators and protective clothing. For post-event emergency use, this is after possible exposure. People who would take 3 shots of anthrax vaccine over 4 weeks and receive a 60-day course antibiotics. The antibiotics are used for people who have been exposed but have not developed symptoms, and many antibiotics are effective. This includes ciprofloxacin and doxycycline, penicillin, amoxicillin, and ampicillin. If someone has symptoms of anthrax, it is important to receive medical care as quickly as possible. Regarding transmission and epidemiology, anthrax can be found naturally in soil. Domestic and wild animals can become infected when they inhale or ingest spores in contaminated soil, plants, or water. Humans can be infected through direct contact with skin, ingestion, or inhalation of spores, and therefore the activities that put people at greater risk of exposure to anthrax spores include people who handle animal products, veterinarians, livestock producers, travelers, laboratory professionals, and in the case of bioterror events, it includes mail handlers, military personnel, and response workers. Anthrax is currently endemic in parts of South and Central America, Southern and Eastern Europe, Asia, and Africa, in the Caribbean and the Middle East. These places lack public health regulations to prevent exposure from anthrax. Human anthrax in developed countries is generally associated with occupational exposure, so it's actually quite rare to be exposed to anthrax in the U.S. Anthrax can be spread by bioterrorist attack or biological warfare. And anthrax is one of the most likely agents to be used in bioterrorism because anthrax spores are easily found in nature, they're easily produced in a lab, and can last for a long time in the environment. So that's all I have on anthrax. These are my cited sources.